Many women, when they are advised hysterectomy, have a lot of thoughts about how our life will change after hysterectomy. They have many questions and no answers. So today in this video, we will be discussing about the most common fears a woman has or most common questions that go through her mind when she has been advised hysterectomy. For all those who are not aware, hysterectomy means removal of the uterus. Will I undergo menopause after removal of the uterus? The answer is no. Uterus removal or hysterectomy means removal of the uterus along with the fallopian tubes. The fallopian tubes are removed nowadays because they serve the purpose of reproduction, and without a uterus you can't get pregnant. Also, they decrease the risk of ovarian cancer if removed. The ovaries are generally preserved up till the age of 55 if they are normal. And the ovaries are the ones which are responsible for hormone production, that is estrogen and progesterone, or the female hormones, which once they decrease are responsible for menopause. If we are preserving the ovaries, the hormones are remaining intact and you wouldn't be facing menopause immediately. The menopausal symptoms like mood swings, anxiety, vaginal dryness, loss of libido, of course will not come in them. However, if you are someone who has ovaries which are abnormal, like there is a risk of recurrence of endometriosis, there is a risk of ovarian cancer, then it is more beneficial to remove the ovaries than to preserve them. Doctor, will I gain weight after my hysterectomy? The answer is no. Women have to understand that in the perimenopausal age group, that is in the age group from 40 to 50, women, we tend to gain weight in our midsection around the hips. This is because of slowing metabolism, because of loss of muscle mass and fat deposition. To beat that, we need to do regular exercise, including a mix of aerobic and strength training exercises, which should start in our early 30s itself. If we do not do that and we continue eating in the manner which we were eating in our younger age, then we definitely are going to gain weight in our midsection. Similar is for surgery. After surgery, we have to get back to our routine activities as soon as possible. Exercising that includes walking, running, strength training, aerobic activity, abdominal exercising, all of it can be resumed after 6 weeks. That doesn't mean that we cannot do any exercise immediately after surgery. After surgery, after 10 days, we recommend you to start walking around 15 to 20 minutes. Slowly and steadily, you can up the exercise, you can increase the intensity, and by 6 weeks, you can get back to everything that you were doing before. If you fail to do that, and you will eat as before, then of course we will gain weight. But per se, hysterectomy or removal of uterus is not responsible for weight gain. Will I feel different after hysterectomy? The answer depends on why the hysterectomy was done. If the hysterectomy has been done because you have been suffering from heavy bleeding, iron deficiency anemia, you feel tired all the time, because of severe pain due to endometriosis, pain all the time in between the periods as well, then believe me, after hysterectomy, you will feel relieved and pain-free and will have a much better quality of life than before. What about sexual life? Will sexual life be affected? Sexual life will not get affected. You can start penetrative vaginal intercourse after 6 to 8 weeks, depending on advice from your doctor. And the experience will not be different for either you or your partner. It may be better for you or enhanced for you if intercourse was painful due to endometriosis, due to pelvic discomfort, due to large fibroids, then it may be a better experience. Also, the vaginal length is not compromised during hysterectomy, especially laparoscopic one. And even the libido loss is not there if the ovaries are preserved. So if the doctor has advised you to go for a hysterectomy, it means that you have exhausted your other management options and it is the wisest thing to do. Think about your choices, weigh your benefits or pros and cons wisely, and then take a decision about what you need to do. Thank you for watching this video and hope it was informative.